Welcome to this Medicare 101 presentation from SHIBA of Lane County. Before we start, let me tell you a bit about SHIBA. We are Senior Health Insurance Benefits Assistants, a free program administered by state and county organizations including ODHS. We provide free and unbiased Medicare counseling and advocacy. We're sponsored by grants, so we have no financial incentive to sell you on a plan. And counselors must have at least 40 hours of training up front, plus 12 hours of training annually to stay on top of the latest and greatest in Medicare. SHIBA can help you by providing comprehensive information about Medicare and related health insurance, helping you analyze plans and supplements, connecting you to computer-based and community resources for your unique situation, processing enrollments, and giving Medicare presentations to your workplace or community group. Here are the questions we'll answer today. What is Medicare? When should I be thinking about Medicare? What are the different parts of Medicare? What are the Medicare options that I have? What financial assistance is available? And what are some common scams to look out for? Let's get started. What is Medicare? Medicare is a health insurance program typically for people ages 65 and older, but also for people who have been on disability for more than 2 years and people who qualify based on certain diseases. Medicare is administered by the Centers for Medicare and Medicaid Services, or CMS. Medicaid is a separate program for low-income beneficiaries that can work with Medicare in certain circumstances. You'll sign up for Medicare when you turn 65 or when you've been receiving Social Security disability benefits for 24 months. You can also qualify if you have end-stage renal disease, ESRD, or ALS, also called Lou Gehrig's disease. If you're drawing Social Security, you're signed up for Medicare Part A and B automatically. If you aren't drawing Social Security, call the SSA office to sign up within 3 months of your 65th birthday. Let's talk about the process of enrolling at age 65. This is called your initial enrollment period, and it lasts for 7 months, starting 3 months before you turn 65. If you sign up before your 65th birthday month, coverage starts on the first day of your 65th birthday month. And if you sign up during or after your birthday month, coverage starts the first of the following month. If you're already drawing Social Security 4 months before you turn 65 or before your initial enrollment period, your enrollment to Medicare will happen automatically. You'll receive a welcome package 3 months before your Medicare coverage begins. If you aren't drawing Social Security, you can sign up at the SSA office or at ssa.gov. Test your knowledge. Marianne turned 65 on April 5th. She's signing up for Medicare during her initial enrollment period. When does her initial enrollment period start and end? Her initial enrollment period is January through July. If she enrolls in February, when does coverage begin? April 1st. What if Marianne enrolls in May? June 1st. There are certain circumstances when you would enroll at under age 65. For example, if you're getting Social Security disability benefits, you'll be enrolled in Medicare starting the 25th month after benefits begin. You'll receive a welcome package 3 months before Medicare coverage starts. Test your knowledge. Ashley started receiving disability benefits from Social Security in March of 2024. When will her Medicare coverage begin? April 2026. When will Ashley get her welcome packet with her Medicare card? January of 2026. Another time you might start enrolling in Medicare is when you retire. If your or your spouse's employer provides health insurance, you can usually wait to lose that insurance before you enroll in Medicare. You should still sign up for Part A, which has no cost for most people. You should check with your HR department to see if this applies to you. Test your knowledge. Jan and Frank are married. Frank is 64 and eligible for Medicare soon. Jan is 66 and working with her employer health insurance covering them both. Does Frank need to sign up for Medicare at 65? The answer is that Frank and Jan should both enroll in Part A, but they don't need to enroll in other parts until Jan retires. All right, let's go over the parts and pieces of Medicare. For starters, you have Original Medicare. This is Part A, inpatient hospital insurance. Part B, medical services and supplies. Then you have a choice. You can either add on Part D, prescription drug insurance, and optionally a Medigap or Medicare Supplemental insurance. Or you can have your insurance managed privately with a Part C Medicare Advantage plan. An important thing to remember is that you must get prescription drug insurance, whether it's through a Part D prescription drug plan or a Part C Medicare Advantage plan. If you don't get prescription drug insurance, you could be subject to a premium penalty, which could follow you for the rest of your life. We'll get more into that later. Let's get into what each of these means. Starting with Part A, hospital insurance. You can enroll in Part A whenever you're first eligible for Medicare, whether or not you're retired. Part A covers inpatient hospital care, skilled nursing facility care, nursing home care, hospice care, blood, and some home health care. Part A costs include no monthly premium for Part A if you or your spouse have paid into Medicare for 10 years. For hospitalization, you pay by benefit period. A benefit period begins the day you're admitted to the hospital as an inpatient, and it ends when you have not had any inpatient care for 60 days in a row. First, you'll pay a $1,676 deductible. Then you have a $0 copay after that deductible for your first 60 days as an inpatient. For skilled nursing facilities, hospice, and home health care, there is no deductible or copays, but there are time limits. Let's run through a scenario so you understand those costs. Marjorie is admitted to the hospital for a scheduled hip replacement surgery. She stays for 7 days for recovery and rehabilitation. Part A covers her hospital care, room, meals, nursing care, and medications. About 2 weeks later, she develops an infection at the surgical site. On day 20 of her benefit period, she is readmitted for IV antibiotics and monitoring. She stays in the hospital for 10 days. After Marjorie's infection is treated, her doctor recommends a short stay in a skilled nursing facility, or SNF, for rehabilitation. Because she was hospitalized for at least 3 days prior, Medicare Part A covers up to 20 days of SNF care at no cost. She stays for 25 days. After Marjorie returns home, she has no further issues related to her hip replacement. So let's look at that cost breakdown. Her benefit period lasted for 55 days, starting the day of her scheduled surgery and ending when she returned home from the SNF. The Part A benefits used were hospital inpatient care, 2 stays, and skilled nursing facility care of 20 days. What Marjorie paid was a $1,676 deductible and a $1,047 SNF copay. This is $209.50 per day for the 5 days beyond her 20-day limit at the skilled nursing facility. Let's move on to Part B, medical services and supplies. You can enroll in Part B whenever you're first eligible for Medicare. You can delay if you're getting what's called creditable coverage or employer insurance equivalent to Medicare. What's covered by Part B? This is the heavy hitter of Medicare. It's physician, specialist, and mental health services, emergency room and urgent care, diagnostic tests, lab tests, MRIs, CT scans, and X-rays, Part B drugs such as chemotherapy, ambulance, diabetes supplies, durable medical equipment, and preventive care. What does Part B cost? Well, there's a premium of $185 per month. This can be higher for those with higher income. The premium is drawn from your Social Security check, or it's paid to Medicare quarterly if you're not drawing Social Security. And low-income programs are available. After that, there's an annual deductible. In 2025, that's $257. After that, you pay a coinsurance of 20% for each Medicare-covered service or item after you've paid your deductible. Some services are $0. Let's do another scenario with Gloria's shoulder. Gloria visits her doctor regularly for diabetes management and mentions a shoulder injury. She had her regular wellness visit with her primary care doctor, who did a health risk assessment, reviewed medications, and discussed diabetes management. Her doctor ordered an A1C blood test and asked her to come back the following week for a follow-up for a flu shot and a follow-up on her shoulder. Gloria came back and had her doctor visit, received the flu shot, and had her shoulder examined. The doctor referred her to an orthopedic specialist. Later, she saw the orthopedic specialist, who recommended an MRI at an outpatient facility. The MRI confirmed a rotator cuff strain, and Gloria was prescribed physical therapy. She had 10 sessions of physical therapy and feels much better now. Let's go over the cost breakdown, what Gloria paid after her premium and deductible. For her wellness visit, that's something that Medicare covers 100%, so Gloria paid nothing. Same with the A1C blood test. Medicare covered all of it, Gloria paid $0. For her doctor visit for her shoulder, Medicare covered 80% of the visit, we'll call that $80, and Gloria paid 20% or $20. For her flu shot, Medicare covered it entirely at 100%, so Gloria paid $0. For her orthopedic specialist visit, Medicare covered 80% or $140, and Gloria paid 20% or $35. For that MRI scan, Medicare paid 80% or $1,000, and Gloria paid 20% or $250. And then for her 10 physical therapy sessions, Medicare covered 80% or $1,000, and Gloria paid 20% or $250. So Gloria's total out-of-pocket after premium and deductible was $555. Next, let's get into Part D prescription drug plans. When can you enroll in Part D? Whenever you're first eligible for Medicare. You can delay if you're getting creditable coverage or employer insurance equivalent to Medicare. What's covered by Part D? Part D plans are managed by private insurance companies, so they differ from plan to plan. All plans must cover a wide range of prescription drugs that people with Medicare take, and after that, each plan has a list of covered drugs called a formulary. Formularies are organized into tiers, and each tier has different copays. So Tier 1 are generics with low copays, and drugs get more expensive in higher tiers. What does Part D cost? The premium varies by plan. It can be anywhere from $0 to $127. Deductibles also vary by plan, between $0 and $590. The copays and coinsurance varies by plan, but there is an out-of-pocket maximum of $2,000 per year. You can compare plans on Medicare.gov or with help from SHIBA. Next, we'll talk about Medicare Supplemental Insurance, also known as Medigap. Enrollment for Medigap is a bit different. Your Medigap open enrollment period starts the first month you have Part B and you're 65 or older. People younger than 65 can't get a Medigap. You have 6 months to enroll in Medigap, and after that you may have to pay more, you may have fewer Medigap options, and you may be denied a policy if you don't meet underwriting requirements. What's covered by Medigap? Well, Medigaps help with the costs that Part A and Part B don't cover. For example, that 20% Part B coinsurance. There are 10 standardized Medigap policies, each with varying levels of benefit. What does Medigap cost? Medigap plans are managed by private insurance companies, so prices differ from plan to plan, even for the same standardized plan. Also, prices can increase as you get older or as inflation increases. Plan G has the best coverage, and you could estimate about $150 a month average at age 65, increasing to about $275 a month at age 75. Because you're paying for a Medigap that covers your copays and coinsurances, you have an effective max out-of-pocket of $1,800 a year, or however much your premium is times 12. Let's go through a scenario to show how it works. This one's called Rick's Heart Scare. Rick wakes up with chest pain and shortness of breath and calls 911. Paramedics take him by ambulance to the emergency room. Rick is admitted to the hospital for 3 nights while doctors monitor and run tests, including a cardiac catheterization. No surgery is needed, and he is discharged with cardiac rehab referrals. A week later, Rick visits his cardiologist for a follow-up. He undergoes an echocardiogram to check heart function and starts a 12-session course of cardiac rehab therapy. So here's what Rick paid after his premiums and deductible. For his ambulance ride, Medicare covered 80% or $800, and Plan G paid 20% or $200. For his hospital stay, Medicare covered all but the deductible, but his Plan G paid for $1,676 Part A deductible. For the cardiac catheterization, Medicare covered 100%. For the cardiologist visit, Medicare covered 80% or $120, and Plan G paid for the other 30. For the echocardiogram, Medicare covered 80% or $400, and Plan G covered the rest of the 20% or $100. And then for his cardiac rehab, 12 sessions, Medicare covered 80% or $960, and Plan G paid 20% or $240. So Plan G paid out $2,202, and Rick only paid his $210 a month for Plan G premium. Now let's shift gears to Part C, which is Medicare Advantage. What are Medicare Advantage or MA plans? Medicare Advantage plans are Medicare managed by private insurance companies such as United Healthcare, Providence, Pacific Source, and others. Medicare pays that company a monthly rate to manage your Medicare, and then you might have an additional premium. They are similar to the group health plans that you might have had through work. When would you enroll in Part C? Your first opportunity to enroll is when you first have both Part A and Part B. Then you can enroll to and from MA plans annually during open enrollment. One common question is it hard to go back to original Medicare after you've enrolled in Medicare Advantage? Technically, no, you can change back during open enrollment any year. But if you want to go back to original Medicare, it can be tough to get a Medigap due to medical underwriting. What's covered by Part C? Benefits can vary dramatically from plan to plan. All plans must include all services covered by Part A and Part B. Part C plans also usually include prescription drug coverage. Then they might have additional benefits such as vision, dental, hearing, alternative care, fitness programs, and more. What does Part C cost? The premium varies by plan, but many Part C plans have a $0 premium. Remember though, you're also still paying the Part B premium. Your deductible varies by plan, often $0. Your copays and coinsurances vary by plan, and the max out-of-pocket varies by plan as well. You'll often see Part C plans split up into HMOs and PPOs, so let's go over what that means. HMOs are health maintenance organizations, and this is a version of Medicare Advantage where all of your care is managed with in-network providers that coordinate with each other. HMOs can be less expensive, but you must have referrals and you won't get out-of-network coverage. PPOs, on the other hand, are preferred provider organizations. You pay less if you use providers within the plan's network, but you can still go to out-of-network providers for a higher cost. Let's do another scenario, which is Greg's Medicare Advantage journey. Greg woke up feeling dizzy and disoriented one morning. His wife drove him to an urgent care clinic where doctors suspected dehydration and an irregular heartbeat. He went to the hospital ER and was admitted for 2 nights for monitoring. Greg resolved to take good care of his heart health. He followed up with a primary care visit for a checkup and was prescribed a new heart medication. Then he signed up for Silver Sneakers so he could take low-impact aerobics at the Y. Finally, he got a hearing check and new hearing aids. Here's what Greg paid after premiums and deductible. This is based on a popular PPO plan in Lane County that has a $0 premium and $0 deductible. So for his urgent care visit, MA pays for everything except for a $55 copay, so that's what Greg paid, a $55 copay. For his hospital stay for 2 nights, the MA plan charges $400 for days 1 through 4 at an in-network hospital, so Greg paid $800. For his primary care visit, MA plan pays for all of it, $0 for an in-network provider, and so Greg paid $0. For his Tier 2 heart medication, his MA plan prices Tier 2 drugs at $10, and so Greg pays $10 a month for his heart med. For his Silver Sneakers classes, the MA plan covers that entirely, and so Greg pays $0. For his hearing exam, the MA plan covers that entirely for 1 hearing exam per year, as long as it's an in-network provider, so Greg pays $0. And for his hearing aids, the MA plan covers 2 a year up to $1,250, and so Greg paid $0. So in total, Greg paid $865. Now that we've covered the parts and pieces of Medicare, let's go over how to make changes to your plan. The busy season for Medicare is the annual election period, also known as open enrollment. This is October 15th through December 7th every year, and new plans take effect on January 1st of the following year. During this time, you can switch your Part C Medicare Advantage or your Part D prescription drug plan. You can change from Part C to another Part C, or Part D to another Part D. If you switch from a Part D prescription drug plan to a Part C Medicare Advantage plan, you're moving from original Medicare to Medicare Advantage and vice versa. Remember, if you go from Part C to Part D or Medicare Advantage back to original Medicare, you're not guaranteed to be able to get a Medigap. Plans change, so check every year. If you have a Medicare Advantage plan, you can also change during MA open enrollment. This is January 1st through March 31st every year. New plans take effect the month after you sign up. You can switch your existing Part C to a different Part C or to a Part D, and you can do this even if you just changed during the previous year's open enrollment. You can also change plans during special enrollment periods. This happens when you lose your existing coverage, like when you have a life change, and the most common ones include retirement and moving. You qualify for a special enrollment period when you have a chance to get other coverage, when your plan changes its contract with Medicare, and under several other circumstances. You can check Medicare.gov or talk to SHIBA if you think you might qualify for a special enrollment period. Medigap plans are a bit different. You can't switch Medigap plans during open enrollment. If you change from original Medicare to Medicare Advantage, there's no guarantee that you'll be able to get a Medigap if you change back. In Oregon, we have a special birthday rule. You can change Medigaps to an equal or lesser plan during a 60-day window around your birthday every year and have guaranteed approval for that change. For example, you can switch from a Plan G to a different Plan G, or a Plan G to a Plan B. And the reason you do this is to lower your premium. Maybe there's a different option out there that has a lower premium that you can take advantage of. A licensed insurance agent can help you make that switch. Now let's talk about the penalties you might incur if you sign up late. If you don't sign up for Medicare at 65 and didn't have creditable coverage for that period, you are subject to a Part B penalty of 10% for every year that you weren't enrolled, and a Part D penalty of 1% for every month you weren't enrolled. If you qualify for financial assistance programs that cover Part B and D premiums, those penalties are covered and you won't have to pay them. And we'll get into financial assistance programs in a bit. Let's go through a scenario. Nancy turned 65 in 2022 and waited 2 full years or 24 months to sign up for Part B. She didn't qualify for a special enrollment period like retirement. What does she have to pay every month in 2025? First, she has to pay that standard Part B premium of $185 per month, and then add on a $37 penalty, or 20%, meaning she has to pay $222 per month in 2025. And that 20% penalty will factor in as premiums change year after year. All right, let's test your knowledge. What part of Medicare covers walkers and canes? Part B. How about an inpatient hospital stay? Part A. What about a blood pressure medication you pick up at the pharmacy? That's Part D. Which part covers dental? Part C Medicare Advantage plans might, depending on the plan. What about flu and COVID shots? That's Part B. How about skilled nursing facilities? Part A. Which part might cover fitness memberships? Part C might, depending on the plan. Claudia is already signed up for Medicare Parts A, B, and D. She does not have a Part C Medicare Advantage plan. When can she switch her Part D prescription drug plan? She can switch during open enrollment, which is October 15th through December 7th each year. Now that you know how Medicare works, let's talk about how you would decide on your options. Starting with Original Medicare, where your primary insurance or who your provider bills is Original Medicare Part A and B. Then you need prescription drug coverage or Part D, and then you can add secondary coverage, a Medigap, to cover what A and B doesn't cover. Why would you choose Original Medicare? Flexibility, you can see any provider who accepts Medicare. For travel, if you travel a lot, Medicare can cover services across the country, which is good if you travel often or spend parts of your year in other locations. And stability, there are fewer surprise charges or changes in coverage with Original Medicare. And then why would you add a Medigap? Medigaps limit out-of-pocket costs. They cover deductibles, co-payments, and co-insurance. Those 20% Part B costs can add up, and a Medigap effectively provides the maximum out-of-pocket for your year. You might add it for predictability, you know what your bill is every month, and for peace of mind. Medigap can cover unexpected costs that arise. Your other option is Medicare Advantage, where your primary insurance, or who your provider bills, is the private company that manages your Medicare Advantage plan. Remember that you still must have Medicare Part A and Part B to get an MA plan. Why would you choose MA? Because of the additional benefits. Depending on the plan, there may be dental, vision, or fitness programs. Also, the costs. Many plans have no additional monthly premium beyond Part B. MA plans have out-of-pocket maximums, which limit your financial risk. And convenience. Medicare Advantage plans combine hospital, medical, prescription drugs, and additional benefits. Let's run through some more scenarios. Craig is a retired pilot who enjoys traveling around the country in his RV with his wife, Bonnie. He wants to see any healthcare provider who accepts Medicare regardless of where he's located. Craig has some chronic health conditions that require him to see specialists frequently and occasionally requires hospitalization or expensive procedures. So what path might Craig consider? Original Medicare plus Medigap could be a good fit since he travels a lot and has expensive procedures. Dave is a retired mechanic who lives on a modest fixed income. He's in pretty good shape and doesn't visit the doctor often, but he's prone to cavities and visits the dentist regularly. He wears contact lenses and likes going to the gym and taking fitness classes. What path might Dave consider? A Medicare Advantage plan with good dental, vision, and fitness benefits could be a good fit for Dave. Mary is a retired school teacher who has a few chronic health conditions that require her to see specialists regularly. The out-of-pocket costs for all the specialist visits can add up quickly, especially for hospital visits and other major expenses. She values predictability and having consistent bills. What path might Mary consider? Original Medicare plus Medigap could be a good fit since it would give her a set monthly payment, or she could look for a Medicare Advantage plan that caters to her chronic health condition. Ultimately, the path you choose is your call. When you make your decision, you'll factor in lifestyle, medical needs, budget, care provider availability, financial risk tolerance, and many other things. Spend some time on Medicare.gov or call SHIBA to talk things over. We're here to give you free, unbiased information. Next, let's talk about financial assistance programs. First is Medicare savings programs. These assist with the Part B premium. You may be eligible if your monthly income is below $1,781 if you're single, or $2,400 if you're a couple, and this is for 2025. Medicare savings programs may also cover deductibles, co-pays, and co-insurance if your monthly income is lower, below $1,325 if you're single, or $1,783 if you're a couple. Contact the Aging and Disability Resource Connection for more information. Additionally, there's the Limited Income Subsidy, also known as Extra Help. This assists with prescription drug premiums whether you have Part D or Part C. It also reduces copays for prescription drugs. Your eligibility is determined by both income and resources, so below $1,976 of income per month and $17,660 in assets if you're single, or below $2,664 income per month and $35,130 in assets if you're a couple. Contact the Social Security Administration for more details. Next, let's talk about how to protect yourself against fraud and scams. A common one is unsolicited phone calls. So know that Medicare, Social Security, SHIBA, and other reputable organizations will not call you unless you call first. So if someone claiming to be from these organizations calls you out of the blue and demands information, don't give it to them. Next, protect your card information. Treat your Medicare and other insurance cards like you treat your credit card or Social Security information. Unless you're on your way to a doctor's office, consider leaving these cards at home in a safe place. Next, watch out for some common scams. For example, offers of a plastic Medicare card. These don't exist. Offers of free COVID tests if you provide your Medicare number. Offers of genetic testing at health fairs. Offers to laminate your Medicare card, and aggressive sales agents trying to sell you on plans that you're not seeking out. And don't give out your numbers. Anytime someone wants your Medicare, Social Security, credit or debit card, or bank account numbers and you didn't contact them first, consider stopping the interaction and calling a trusted phone number back to ensure the validity of the request. Let's talk about next steps. First, if you're not on Medicare yet, make a plan for your transition to Medicare. Next, scope out plans and get questions answered at Medicare.gov. Third, make sure you get your answers from official sources like Medicare, Social Security, the Center for Medicare Services, Senior and Disability Services, licensed insurance brokers, or SHIBA. Fourth, document the interactions you have with professionals. And fifth, keep your paperwork safe and organized. If you'd like to work with SHIBA, here's how we can help. We provide free, unbiased help with Medicare questions. Call us at 800-722-4134. We can help you with Medicare basics, plan comparison, enrollment periods, filing appeals, and scheduling presentations for community groups. Thank you for watching this Medicare 101 presentation.